COVID-19 বা করোনা ভাইরাস ও ডায়াবেটিস সম্পর্কে সামাজিক সচেতনতা বাড়াতে বাংলাদেশ ডায়াবেটিস সমিতি, নন কমিউনিকেবল ডিজিজ কন্ট্রোল প্রোগ্রাম, স্বাস্থ্য অধিদপ্তর, নভো নর্ডিক্স ও জাইকার যৌথ প্রয়াস।
Dear colleagues and friends, in this session for questions and answer, I'm asked to give some answer to the treatment for COVID-19 in people with diabetes. I must confess the fact that there is limited knowledge on the effective treatment or the clinical management for COVID-19 in people with diabetes. However, I would like to give a description of my understanding of the current state. As we all know that diabetes is a disease of inflammation, and in people with COVID-19, they have also shown a heightened inflammatory response. And what we observe in people with diabetes, that there is a heightened inflammatory response in people with diabetes, which is often described as cytokine storm. And therefore the use of corticoid was studied in several clinical trials, but special caution should be taken in people with diabetes. And it is also a hypercoagulable state, and therefore anticoagulant therapy can be considered. There are also lots of discussions, as we know, about angiotensin converting enzyme 2 is the receptor for the virus, and therefore the use of ACE2 inhibitor is deemed to consider with caution. However, I must admit that I have not come across any studies that have shown any adverse effect of the drug. However, many experts are concerned. The next is the hydroxychloroquine, and which has been widely used, but in clinical trials, these are the small clinical trials. Small clinical trial has shown its effect, but in the larger, in a bigger setup, that we do not see any effect. And the largest study that was based on registered data that was published in the Lancet, they have not shown any effect of prescribing hydroxychloroquine in treating patients with for COVID-19. So therefore, I suppose that caution should be taken to use also hydroxychloroquine. So far, remdesivir has shown an improved effect in reducing hospital days for patients with COVID-19, but not death. We all know that these are the patients who most likely may need intensive care, and therefore intensive care units should be made ready for these people. Next question was the risk of the people with diabetes. There again, I will have to start with the poor knowledge in terms of the susceptibility. We still do not know that whether the people with diabetes are at increased risk for the susceptibility for COVID-19. We see that this prevalence of the people of diabetes amongst the people with COVID-19, particularly in the elder population, is not higher than the prevalence of diabetes and pre-diabetes in general population. However, the meta-analysis that many others done, including myself, we have shown that there are 2 to 3-fold increased risk for severity and death. And this is also a kind of high inflammation state, and therefore there is an increased interleukin 6 we observe. And it is also low levels of immunity or low levels of lymphocyte counts are observed, or lymphopenia count that we can say. We have observed poor glycemic control and coagulation function with D-dimer, and high CRP and erythrocyte sedimentation rate. These are the issues of concern that the clinical management should be considered and should follow up. My third question was how we can prevent. In prevention, that we can say that we should follow the general rules in general, that is the good hygiene, hand wash, not to touch face, shower after going out, avoid social contacts, maintain distance while at work or any social gathering, minimum 1 meter distance, And I know that in Bangladesh, this is difficult to maintain, but we should try. Good glycemic control should be maintained. And for the people with diabetes, it is important to maintain physical activities even though inside the house. Try to reduce stress, keep your diabetic medicine available, and seek help from friends, family to avoid close contacts which occurs, for example, in shopping places in Bangladesh. And the last question that was asked to say that what is the role of the IDF? That IDF is actively taking part in the WHO guidelines, and IDF is actively asking its member associations to develop national guides which can be posted in the IDF website for further references internationally. IDF is actively working with the international consortium to maintain supply chain of insulin and emergency medicine globally. IDF is producing a special issue of publication in the International Journal of Diabetes Research and Clinical Practice entitled COVID-19 and Diabetes IDF Perspective. I hope our colleagues from Bangladesh can also participate in these activities.
একমাত্র সম্মিলিত প্রচেষ্টাই পারে কোভিড-19 প্রকোপ বা ভয়াবহতা থেকে আমাদের রক্ষা করতে। আসুন যার যার জায়গা থেকে যার যার দায়িত্ব পালন করি, সচেতনতার সাথে করোনা ভাইরাস প্রতিহত করি। জানতে হবে, জানাতে হবে, ভয় নেই, আমরা আছি।